really in the end, it's what's the physiology of the brain? And I think people really underestimate the prevalence of these metals in our environment. You know, I run these hair mineral tests on people I work with, and, you know, when they come back mercury high or elevated aluminum, I see cadmium, lead, and, you know, it doesn't take a lot of investigating to really find the source sometimes.
Mhm.
You know, I had somebody I was working with just recently, and they came back sky high for lead. And I was like, well, you know, they lived in North Carolina. And I was like, well, you know, I just kind of did a quick Google for Raleigh, North Carolina, lead. At the top of Google, you know, their water, they had water issues with lead in one of their main wells. And it's like, you have no idea. You have no idea unless you start running these tests.
Exactly. Yeah. Yeah. It's quite an insight, and people really appreciate that, because I mean, this is not your traditional allopathic insight into the body. There's very few allopathic practitioners that are looking at these tests and then still how to interpret them. So it really, like you said, is a 1-2 punch, and especially for kids. And let me just touch on that. I've run laboratory tests. I think the youngest patient we ran on was 2 years ago, 2.5 years old. And if I recall, she had a high mercury level at 2.5 years old. So you really start to wonder, at 2.5 years on this planet, how did you bioaccumulate? When I talk about bioaccumulation, that's the lifetime accumulation of all the different sources and the different moments that we have this. And again, mercury, we can talk for hours just on mercury, but it's in our food supply. It can be bound up in our water, our drinks. It comes from the air that we breathe. Some of the stuff is almost inescapable, but once you understand it, you mitigate your exposure as best as possible. And then maybe even beyond your initial detox to clear your body from it, maybe routinely detox, maybe once, twice a year to keep up, be proactive, so to speak, use it as a prophylactic. And what's interesting is when you run acute EEG analysis, what you'll see, especially for kids, is when you look at delta brainwave activity, you'll see a lot of elevation of delta brainwave activity, what we call globally, not just a couple of regions of the brain, but the whole brain map. And we use different colors, so it's easy for the practitioner and the patient or client to understand what that brain activity looks like. But we use the colors red and yellow to indicate either very high or high activity. And these kids' brain maps light up with red and yellow. And from there, we can get a good estimate that they're probably suffering with some toxic effect, particularly heavy metals. And sure enough, when you run a heavy metals test, you're going to find them present. But that 2.5-year-old, high levels of mercury, that was one of the big components of why she had the autism diagnosis and the symptoms to follow. So what we've learned now is, coming back to 2.5 years old, how do you bioaccumulate that much mercury? And at levels I've never seen on the test. But what now is toxic, particularly heavy metals, have become multi-generational. In other words, they're passed down from mom through the placenta. No fault to moms. Again, we all grew up in our generations. There was a lead generation, the mercury generation. We didn't know as much information as we have on hand now. But what we're learning is it's handed down from one generation to the next. And there's estimates that, I mean, this continues the way we go. I mean, look at the autism statistics right now. What is it? 1 in every 5 children born in this country will have some level of autism or neurodevelopmental problem. And that's to be estimated, I think, 1 or 2 in just years. And a lot of it is due to toxicity. I mean, again, I've lectured about toxicity for hours, but it is a big component, especially working with kids.